So I'm Wayne Champion. I'm the Chief Executive Officer of the Riverland, Mallee, Coorong Local Health Network in South Australia. So my first role out of university was as a freelance scuba diving instructor. And I'm not sure it shaped the latter part of my career, but it did set up some things. So there's clearly the pun about working under pressure as a scuba diving instructor. But it did teach me to work with people. It taught me to enjoy what I'm doing and to assess situations before I go into them. The biggest differences are structural, and they relate to the differences in the government structure between the two countries. So in New Zealand there's just one national government and then local councils. Mm-hmm. In Australia there's a national government, then there are state governments, and then there are local councils. Mm-hmm. And so in New Zealand there's one layer of government responsible for all health services, primary health services, residential care, hospital services. In Australia, of course, the Commonwealth Government looks after residential care, looks after primary health services, and the states are primarily responsible for hospital services. The other differences are around the funding for health services. So New Zealand has a population-based funding formula where district health boards are funded according to the population that they serve, and then they manage health services, not only the ones they provide, they also contract and buy health services to meet all of the health needs of their population. In Australia, LHNs, LHDs or HHSs, called different things in different states, are hospital providers predominantly, and exist in an ecosystem with other providers, GPs, residential aged care providers and so on, that are funded separately. So I worked for what was the West Coast District Health Board in New Zealand as both their Chief Operating Officer, so responsible for Greymouth Base Hospital, and also their General Manager of Corporate Services at the time. And so the Christchurch, the Canterbury District Health Board team managed the initial response from the earthquake, and about a week after the earthquake they rang me up and invited me over, and really I had no idea what I was going over there for. They gave me a briefing, and kind of from then on that was it. I was in charge. I still had the support of the team there, but they had just worn themselves out managing the first week of the response. And so for the next 9 months I was based in Christchurch managing the earthquake response through the remaining 3 weeks of the time that Christchurch or New Zealand was in its nationally declared state of emergency, and then through numerous aftershocks and so on since. But it really took me from managing a hospital, a Greymouth Base Hospital as I mentioned earlier, to managing or supporting the management of a health service. So the people that normally manage each hospital were still there within Christchurch, the people that manage GP practices and so on. But I was involved in coordinating the response across the entire health system. And there were 131 GP practices in Christchurch, about 116 community pharmacies, around 105 residential aged care facilities, plus all of the public hospitals, all of the private hospitals, all in a state of emergency and chaos. But actually Canterbury District Health Board had amazing systems and had already established a fantastic response structure. The focus on the purpose for being there, the people of Christchurch, the people affected by the emergency, was a lesson in itself, and the focus on putting the health system back together better than it was to start with. So not replacing things that were broken to start with the same thing was also a huge lesson in its own right. So I guess just in terms of my experience of it, I went from being Chief Operating Officer of Country Health, responsible for 61 hospitals as acting and then interim Chief Operating Officer, to being Chief Executive Officer of one of the new LHNs made up of a region of Country Health. And the focus of the purpose of the change was to bring decision making closer to the communities affected by the decisions, to give communities and consumers and clinicians a voice in decisions that are made about their health services. And so the challenge, of course, is delivering on that. and delivering on that relatively quickly, but in an organisation that is in itself going through a change with the establishment of boards, because prior to the change, the CEO of Country Health reported to the CE of SA Health that reported to the Minister. Now the CEOs like myself all report to a skills-based board that reports to the Minister. And the change in relationship that creates with the department that is still our primary funder and still has to coordinate the health system. So those have been the challenges. And I think, the role of the department in coordinating the system gets really interesting when you've got, emergencies that require system-wide coordination, be it the recent bushfires in South Australia, or be it the looming threat of COVID-19.
Yeah.
So I guess the key attributes are adaptability, ability, the diversity of their experience. It's not apart from experience, but when we look at experience, we're looking at diversity of experience, not just experience in whatever the discipline is. Ability to fit the culture and to contribute to affecting, desired changes in the organisational culture. So diversity means lots of different things to lots of different people, and we have diverse workplaces, we have diverse client bases, we have a diversity of services that we provide aimed at meeting the needs of different populations and different groups within those populations. Increasingly, we try to provide services that meet, that are individualised to every individual's wants and needs. But we struggle because we're trying to do it as one single large organisation. To me, it comes back a little bit to some lessons from New Zealand. So in New Zealand, we have the Treaty of Waitangi. Now, without going into the history of New Zealand and what's right and wrong with that, the treaty essentially has 3 sections. The 3 sections relate to 3 principles. The principles are about partnership. And by partnership, I mean, bringing any group in as a partner and supporting, them to help us meet their needs. Protection of their rights, their individuality, their culture, their customs.
Yeah.
And participation, their right to participate in decision making that affects them, whether it's them as an individual consumer or client, whether it's them as an individual staff member, whether it's their right to participate, in the provision of services. So if you think of a particular ethnic group or a particular consumer group, their right to also, be served by people that are familiar with them in the delivery of health services, their right to participate in the governance of health services and in government generally. So that, if you use those 3 Ps as a guiding principle, generally they meet the needs of most diverse groups. So I've been inspired by different people at different times. Some of the CEOs that I've worked with have inspired me, some of them not so much. And I guess, there are particular CEOs that I've worked with that have probably inspired me more than others. Some would be surprised by that. One in particular, a guy called Kevin Haig, who was the CEO of the West Coast District Health Board at a time back when I was Chief Financial Officer, so quite some time ago. And prior to that, he was responsible for planning and funding, so funding external services. But really his focus on population health, on understanding the needs of the population and about directing services in ways, or shifting resources in ways to meet those diverse needs, inspired me really, and probably got me interested in managing systems instead of services. I guess the top tip is to stay focused on your reason for being. In health, it's about patients, consumers, populations, and health outcomes. So be clear what it is that you're there for, and to never lose focus on that.